Hello, welcome to the Total Knee and Total Hip Replacement class at Gritman Medical Center. I'm Sherry Hottinger. Our goal is to help you navigate through your surgical process here at Gritman. This educational class is going to help you prepare for your surgery. People who participate in total joint education classes and are highly involved in their care have better outcomes. Today's topics will include how to prepare yourself for surgery, what to expect while you're in the medical center, and what to expect when you go home. Goal of surgery is to reduce pain and symptoms and improve quality of life. The number of joint replacement surgeries has been steadily increasing in the United States. A high volume of patients undergo joint replacement surgery at Gritman Medical Center each year, recognizing that no two patients are exactly alike. We monitor our patient outcomes and program closely and work continuously to achieve a smooth process and excellence in safety for our patients. We are committed to excellence. We strive to provide the best clinical care while taking the individual needs of you into account. We incorporate current joint arthroplasty protocols and clinical practice guidelines with cutting-edge technology. Patients who are highly involved in their care before, during, and after surgery experience better outcomes from their surgery. Even if your surgery is weeks or months away, start preparing now. Beginning your exercises before surgery helps your brain and body be more successful with these exercises after surgery. Your surgeon makes an incision over your joint. Damaged surfaces and parts of the joint are replaced with new artificial parts, which are fitted and secured to your bone. Generally, knee and hip replacements last many years. However, several factors can affect the longevity of your joint, such as body weight, activity level, bone quality, and overall health. Take care of your whole body now to take care of your new joint. It's important for you to identify your goals ahead of time and keep those in mind as you work through this process. Keep your eye on the goal, especially when you're having pain. It's a great way to propel yourself to a healthier future. Let's meet your healthcare team. A registered nurse, orthopedic surgeon, you may or may not meet a nurse practitioner or a physician assistant, dietary staff, laboratory staff, a member of our therapy teams, pharmacist, discharge planner, hospitalist, respiratory therapist, or even a member of our environmental services staff. Prearrange to have a coach. This can be a family member or a friend. It's an extra set of eyes, a cheerleader when you go home to help you change your dressing, help with your medications, help drive you to and from your appointments. Plan on this person being with you for at least 2 to 3 nights at minimum. It's imperative you've identified someone to stay with you in the event that your coach is not available or someone you can easily reach by phone. Optimizing your surgical outcome, it's imperative to stay as healthy as you can. Drink 8 glasses of water a day. Decrease the amount of sugary, carbonated drinks. Please don't drink any alcoholic beverages the night before or after your recovery to help optimize your recovery. Please decrease or stop all smoking. It's imperative that you stop smoking, chewing, vaping before and after your surgery to help with your recovery. If you need resources to help stop smoking, please look in the book and you'll see the list of resources that you can reach out to that can help you with this. In preparation for your return home after surgery, you'll need to have your home prepared. Temporarily relocate items to waist level so they're easy for you to grab. Chair height should be 2 inches above the back of your knee. If needed, you can purchase furniture risers to go under the legs of your chair or a thick piece of upholstery foam so it's easier for you to get up and out of your furniture, your chairs, your sofas. Arrange to have someone pick up your mail if needed. Prepaying your bills ahead of time, as well as preparing food ahead of time, will make your transition to home and your recovery smoother. Identifying which doors you'll be using once you get home is imperative. If there are stairs to get into the house, having railing on these stairs is going to help you transferring in and out of the home. as well as making sure there's a clean pathway throughout your home to navigate your walker up and down the hall. Night lights in the hall as well as in the bathroom are helpful. Making sure throw rugs are picked up, any trip hazards. In the shower, having a non-slip surface, railing in the shower, elevated toilet seats, shower chairs, anything that's going to make your recovery easier. If needed, temporarily relocate items to the first floor so you're not having to go up and down stairs. Arrange to have your pets cared for while you're in the hospital, as well as when you're home. Make sure your pets aren't jumping up on you. It's imperative that you wash your hands before and after any interaction with the pet, and teach your coach to do the same, making sure they've washed their hands before they change your dressings. Don't allow your pet to lay next to your incision. If you're laying on a surface, a couch, a chair, where your pet has been, throw a clean sheet down just to make sure you're not getting any pet hair near your incision area. It's important to discuss with your surgeon all medications you're on over the counter or prescribed, any supplements you're taking. Medications can have interactions with anesthesia with pain medication, so it's important to let your surgeon know these before surgery. It's important to let your provider, as well as your anesthesia provider, know what type of narcotics you take. This will help determine what pain medications will work the best for you while you're here in the hospital and with your discharge. As always, any information you share is kept confidential. Between now and your surgery, choose your physical therapy clinic of choice. Call the clinic 1 to 2 weeks before your scheduled surgery. Let them know when your surgery is. If you have not yet selected a physical therapy clinic, Gritman Therapy Solutions is a great choice. You'll receive a phone call from a member of our pre-surgery team here at Gritman. At your appointment, you will discuss your past medical history, your current medications, and any surgical questions you may have. Please have a list of your current medications ready, or if it's an in-person, please bring your information with you. You may have blood tests, underarm or nasal swabs, and an EKG of your heart. For any insurance questions, look on the back of your insurance card. There's a phone number on there that you can reach out to. You will be asked about an advance directive upon arrival to the medical center. If you have an advance directive currently, please bring a copy so we can place it in your file. Otherwise, if you want more information, we can have one of our team members work with you. If anything were to change in your health between now and your surgery date, reach out to your surgeon and let them know. Most total knee and total hip surgeries go very well, although there are some risks that we need to discuss. These risks being infection, bleeding, nerve damage, or loosening of the new parts that have been placed by the surgeon. Other possible adverse reactions: breathing difficulty, heart attack, and death. An additional risk is blood clots, and we will discuss how to minimize this risk shortly.
I'm Holly Hall. I'm a registered nurse at Gritman Medical Center. I'll be taking care of you on the medical surgical floor. On the night before your surgery, there's many things that you need to pack. Please bring your most current medication list, especially if it's changed since your pre-op appointment. Please bring clean, loose-fitting clothing, socks, underwear, and comfortable shoes. Please pack your toiletries, glasses, hearing aids, dentures, and a CPAP machine if you use one. Consider noise reduction headphones, as sounds in the hospital may not allow you to sleep very comfortably. Important phone numbers and a cell phone chargers are very important as well. Please bring your driver's license, photo ID, and insurance cards. If you want to bring any pastime activities, books, magazines, cell phone, iPad, there'll be a little bit of downtime where you can enjoy these activities. Also, please bring your total joint replacement book. If you own your own walker, also please bring that and we can get it fitted to you while you are here. Some items that we do not want you to bring are money, jewelry, any other valuables, and any medications from home unless instructed to by your preoperative nurse. On the night before surgery or the morning of, please remove all of your makeup, nail polish, and remove your contact lenses. Shower following the directions given to you by your pre-surgery nurse. If needed, you can take pain medication before you go to sleep, along with any medications instructed to you by your pre-admission testing nurse. Let's just say midnight is the magic number. After midnight, please do not eat, smoke, chew gum, chew tobacco. It is okay to drink clear liquids up to 4 hours prior to surgery. Only take certain medications with a tiny sip of water if you were instructed to do so. These instructions are imperative to keep you safe while undergoing anesthesia. Not doing these guidelines can cause life-threatening complications and cancellation of your surgery. On the morning of surgery, take a shower and follow the directions by your pre-admissions testing appointment. Do not shave at or near your operative site. Staff will use special clippers to protect your skin. Pat dry with a clean towel. Do not use lotion, powders, or deodorants. Put on fresh, clean clothes and take only specific medications as you are instructed to do. On your arrival to the hospital, please travel safely and arrive at the same-day center at the time you are instructed to do so. This time is approximately 2 hours before your surgical time. Your family or coach may stay with you while you are in the same-day surgery department. This is a busy time while staff continues to prepare you for your surgery. When you arrive at the same-day surgery department, they're going to review medications and your general health. They're going to do a skin check and preparation for surgery, review surgical consents, and personal items will be given to your family and transported to your room on the medical surgical unit. At that time, you will change into a special gown for surgery. Once you're in your special gown, an IV line will be started by skilled staff. A certified, registered nurse anesthetist will come and talk to you and answer any questions you may have about your anesthesia care.
Hello, I'm Dustin Gill. I'm a certified registered nurse anesthetist here at Gritman Medical Center, and I wanted to talk to you a little bit today about your upcoming joint replacement. We approach joint replacement as a three-pronged approach. The first prong of that is we're going to come up with a plan for you, okay, developed with your specific needs in mind in the surgery that you're having in mind. The three prongs are going to be general anesthesia. That is going to be the sedation that we give you to get through the surgery where you're asleep and taking a little nap as we perform everything, okay? Spinal anesthesia, that is going to be the little injection in the back. And what that's for, okay, that little injection is going to help us numb you up so that we can do the surgery with as minimal pain as possible, okay? The other thing is that it minimizes blood loss as well, okay? The other prong of our approach is regional anesthesia, okay? Regional anesthesia for us means that we're able to target a nerve or an area that is going to be highly impacted by the surgery and diminish its response to that surgical input. So with that in mind, we have several different ways of going about targeting those nerves and implementing a way to diminish the amount of pain that you're going to experience during this overall care. Now, one of the things we need to talk about as we're discussing pain, okay, just as a little caveat, is that we're going to continually, from the time you enter the hospital until you leave, we're going to continually be asking you what your pain score is, okay? The score goes from 0 to 10. Now, realistically, we need to come together and set realistic goals. What I mean by that is 0 is probably not attainable. Our goal for you is to be somewhere in that 3, 4, maybe even 5 range, as long as you're comfortable and you're functional and you're able to perform the duties or the therapy or the walking or whatever we need to do to get you moving forward without pain being a hindrance for that. In speaking of regional anesthesia for covering your pain needs, okay, one of the things that we offer here and do every chance we get is when we have total knees, okay, specifically total knees, we can actually put a catheter in that will allow us to give you local anesthetic along the nerve that innervates the knee for up to 3 days afterwards, okay? So one of the advantages that gives you is after the surgery, we put it in recovery, okay? And then you have 3 days where you're getting constant local anesthetic to the area and relieving the pain, therefore augmenting your recovery, okay, allowing you to participate in therapy more effectively and efficiently, and being able to go home for a day or two while you transition over into your oral pain meds from there. And that allows us to give you a really excellent start to your recovery for your total knee. When you arrive for your surgery, one of the anesthesia providers will come to talk to you on the morning of your surgery. We will get an accurate history and physical. We'll talk to you about your surgery upcoming, and we'll discuss the options for anesthesia. As we discuss those options, we're going to detail the risk and the benefits, okay, and answer any questions you may have regarding anesthesia for your total joint.
Your surgeon will also come talk to you about any last-minute questions that you may need to have answered. Your surgeon will then initial your surgical site. Once you have talked with your healthcare team, you may be given some medication to help you relax. After you're set up in same-day center, you will be taken to the operating room. There in the OR, a highly trained team of specialized staff will position you with expertise. From there, they will do a universal protocol or timeout. This is for your safety. Preventative antibiotics will be given before your incision is made by your surgeon. You will be continuously monitored while you are in the OR, and your temperature will be closely regulated with your warming gown. After your operation is complete, you will be taken to the post-anesthesia care unit, also known as the PACU, or the recovery room. The time here is usually 1 to 2 hours. At this time, the surgeon will update your family about your surgery, and your family will already be in your room waiting for you on the medical surgical unit. You will have one-on-one specialized nursing care as you awaken from general anesthesia. You will have many monitors in place. After 1 to 2 hours, it will be time to see your family. If this time is significantly longer than expected, we will make every effort to update your family on your condition. Once you are awake, you will be taken to your room on the medical surgical unit. Once you arrive to the medical surgical unit, you're going to see that we will do a detailed nursing handoff. Both nurses will check your skin, and visitors may be asked to step out of the room while we do this, for your privacy. Once you reach the medical surgical room, you will continue to be on constant monitoring. Vital signs, including your heart rate, blood pressure, breathing, oxygen level, and temperature will be measured. Any remaining effects from anesthesia and surgery will also be measured. We will also be monitoring any remaining effects from your anesthesia and surgery, including your alertness, nausea, bowel function, eating, drinking, urinating, and managing your pain. We are going to help you learn about breathing exercises that we would like you to complete while you are there, and you will continue to wear the soft compression sleeves on your feet to help prevent blood clots. On the medical surgical unit, safety is our highest priority. We ask that you do not get up without any help. We will make sure that you have call alarms, and if needed, if you do try and get up on your own, we will put bed alarms on you as well as POSI alarms. We do have a gait belt for safety. We supply non-skid socks, and we'll also make sure that you have a walker in the room if you do not bring one of your own. While you're with us on the medical surgical unit, we'll make sure that your medications are managed. Ordered by your surgeon and monitored and managed by our pharmacist and administered by our nurses. We will identify your name and date of birth every time we administer your medications. We'll scan your armband with each medication into the computer, and we will ask you your pain scale before and within an hour of administration. We will do our best to explain each medication and its side effects to you so that you understand what we are giving you and why you're taking it. Once you're awake on the medical surgical unit, we are going to do our best to get you out of bed as soon as possible. We typically begin by getting you out of bed and walking within the first hour after surgery. Our goal is within 4 hours from the recovery room. You will use a walker for support and stability. You will receive physical therapy and/or occupational therapy evaluation and a customized therapy program. Do not get out of bed without the assistance of our team and are cleared to do so. It is best to take your pain medication before your physical therapy session to allow better participation. After waking up from surgery, we're going to ask that you get something to eat and drink. The idea here is take it slow. We put you to sleep and your gut went to sleep as well. So water, ice chips, and a light meal to start. We really want to make sure that we're managing your nausea after recovery. If you have any special diet considerations, please let us know before surgery, as we would like to cater to you while you are here. For your best recovery, we're going to instruct you on how to do breathing exercises. These include cough and deep breathe and the use of an incentive spirometer. The incentive spirometer, we're going to ask that you do this 5 to 10 times every hour while you're awake. The use of the incentive spirometer will help prevent fluid collection, pneumonia, and decrease fevers. If you have sleep apnea and own a CPAP or a BiPAP, please have it serviced prior to your surgery and bring it with you to the hospital. After all orthopedic surgeries, you're at an increased risk of developing a blood clot. Ways that we minimize that risk for you are by applying sequential compression devices, also known as SCDs. These will gently squeeze your legs and improve circulation to help prevent blood clots. Other things that we do for you is encourage you to stay hydrated, use high efficiency in the OR, put you on a blood thinner for 2 to 4 weeks after surgery, and close monitoring throughout your stay. Please do not stop taking your anticoagulant medication until directed to do so by your surgeon. We would also like to talk to you a little bit about sleep expectations the night of surgery. You're in an unfamiliar place with unfamiliar environment. We really want to make sure that you understand that your sleep patterns may be changed. Anesthesia can affect that. You're also going to have monitors, including IV pumps and vital sign machines. You will also have foot compression devices, and nurses may be coming in to perform assessments every 2 to 4 hours. Your surgeon will also have prescribed for you certain medications that will fall during certain time intervals throughout the night. The day after surgery, your IV will have been stopped, and nursing and therapy staff will help you with bathing and personal care. They will teach you how to continue this on your own with minimal assistance once home. We will make sure that you are out of bed for all of your meals, and physical and occupational therapy will arrange to meet with you at certain times during the day. Please wear loose, comfortable clothing, gym shorts and a t-shirt, comfortable shoes. Please add supportive shoes with no back. Please no flip-flops. This is a wellness program, so we expect that you will be up, walking in the hallways, and walking to the bathroom assisted. There will be lots of rest between activities. For our total knee patients specifically, we really have some precautions while you're in the room. Please do not rest with a pillow behind your operative knee. Roll up a towel and place behind the ankle with your feet elevated. Do not sit in a low chair. Do not sit with the operative leg hanging down for more than 30 minutes. During your stay with us, you will be provided with 4 ice packs and a specialized wrap based on your surgery. We will change out the ice packs every 4 hours, and we encourage you to elevate. If your discharge plan is to discharge the same day of surgery, you and your coach will receive individualized education related to your discharge plan. Discharge day is the day you and your surgeon agree you are safe to go home. On that day, it's going to be very busy. Your discharge orders will be processed by your bedside nurse or the charge nurse. Orders will be verified. Prescriptions and medical equipment will be given to you. Follow-up appointments will be scheduled or confirmed. Educational and discharge paperwork will be printed and given to you. Your family or coach will participate in the discharge process. If you need a discharge planner, they will be provided. During discharge preparation, we will be teaching you and your coach how to care for your surgical dressing and incision. We will be removing your IV catheter. We will be packing your belongings, including your gel packs and extra dressings. We will be reviewing all education and orders in your printed discharge packs. At that time, we will answer any questions that you and your coach may have, and you will be provided with contact information to use if you have any questions. Your prescriptions will be either e-scribed to the pharmacy of choice, or they will be printed by your surgeon and given to you. If going home is not an option after your surgery, please talk to your surgeon prior to surgery, and case management will assist to arrange appropriate rehabilitation. Educational and discharge paperwork will be printed and given to you.
My name is Mark Heinlein. I'm a physical therapist at Gritman. I work in MSU, the Med-Surg unit, and one of my jobs is to make sure that people are ready for discharge home to outpatient services. You may see occupational therapists also at the morning of the surgery, and you will see me. One of the first things we will do with you is to be sure that you're ready to get up. Mobilization is a very important part of the day of surgery. So we will come into your room, introduce ourselves, and if you are ready, we will sit you at the side of the bed, take some blood pressures to make sure everything is okay, do a transfer to a recliner chair. If that goes smoothly, you will take your first walk. Your second session with rehab physical therapy will be ideally with a family member present to help you with your exercise program. One of the things we'll be doing at the second session of your physical therapy will be going down to the physical therapy gym and doing some exercises. Ideally, your coach or family member will be present with you, and they may even be encouraged to coach you through the session with PT looking over their shoulder. We will be doing a series of exercises that you should be able to accomplish fairly readily. The first ones will be done sitting. One would be a long arc quadricep exercise, which is exercising the muscle that extends your knee. The next exercise is hamstring isometrics. You will sit with your new knee or your operative leg against the opposite leg, heel to shin, and contract the muscle of the hamstrings. The next one we do, we'll lay down and we will do quadricep setting, which is just an isometric contraction of the quadricep. The next one after that will be gluteal setting. Gluteals are the muscles of the buttocks, which help you get up and down from a chair. You will be doing those isometrically also. The next exercise, you may need help from your coach because not everyone can straight leg raise the day of surgery. They will put their hands under your heel and help you lift the leg straight off the mat. It's very important to keep up with your exercises. It's crucial for your outcome, your functional outcome, to be doing these on a regular basis. You will be seeing an outpatient physical therapist shortly after your discharge, but still, these exercises are very important to do until that time happens. The exercise program that we introduce you to should be done frequently. We recommend 3 or 4 times a day. However, one need not do every exercise at every session, but rather to move frequently. So that could be several times a day. Your surgeon will decide whether they will do an anterior or a posterior approach. Both of these approaches have different precautions postoperatively. Your therapist will review these precautions very thoroughly so that you and your partner both have them memorized. Ankle pumps are a very important exercise to help with circulation while you are less active in bed. Ankle pumping is simply sitting or lying and pumping the ankle as if you're listening to some good music. Quadricep setting is locking the quadricep muscle up in an isometric fashion repetitively. This will help strengthen that muscle and keep it going well. Heel slides are an important exercise both for the hip and the knee. It involves laying on the back on your bed and bringing the heel up toward the buttock. You can do this repetitively. You will have specific goals from rehab services in the hospital. Number 1, you will be independently ambulatory. That means you will be using a walker to get around the house, and you should be safe to do this before you leave the hospital. Number 2 is if you have steps in your home, we will teach you how to go up and down the stairs safely. If you have stairs to enter your home, you may need the help of a partner to safely negotiate them in and out. Number 3, you will be independent on all of your exercises that you need to do before you go to outpatient services. Number 4, we will make sure that you feel safe doing your vehicle transfers before going home from the hospital. If you're going to be traveling a long way, this is especially important. Your therapist can come down with you on your day of discharge and escort you and guide you through the proper technique for getting in and out of your vehicle. When you are discharged from the hospital, you will have an appointment to see your physical therapist as in the outpatient setting. This is very important for you to do, to follow through, to get a good result. It's very crucial to maintain motion and to keep strength up within a narrow window of time to get a good permanent result. When you go to your physical therapist, it would probably be to your benefit to take your regular pain medicine beforehand so that you are able to better able to tolerate the session.
Returning home, it is crucial that you continue to ice and elevate 4 to 6 times a day, 30 minutes at a time. Elevate the operative extremity throughout the day as well. Lying on your non-operative side is elevation for your hip. For example, if you had a right hip done, laying on your left side and placing pillows between your knee is elevation. Elevating your knee is laying flat on your back on your bed or your couch with your ankle propped up with pillows, remembering not to place any pillows behind the operative knee. Once you're home, continue to do your home exercises that our physical therapy team has provided you with, as well as the exercises in your total joint replacement book. Make sure you go to physical therapy on your scheduled days. The days you're not going to physical therapy, walk frequently throughout your home as well as do your at-home exercises. Do not submerge your surgical site in a bathtub, hot tub, swimming pool, river, lake until your surgeon has cleared you to do so. It must be completely healed with not even a scab on it. Do not sit in a chair with the operative extremity hanging below your heart for longer than 30 minutes. Do not drive or operate any machinery until your surgeon has cleared you to. Do not add any medication to your regimen without guidance from your surgeon. As always, reach out with any questions. For a complete list of when to contact your surgeon, please refer to your total joint replacement booklet. One of the most common side effects after surgery is constipation. After surgery, you may experience constipation. Fluid and fiber are the foundation for treatment for constipation. Increase your fluid and fiber intake over the course of your recovery. It's recommended to keep a water bottle with you most of the time so you drink more water. In some cases, you will need to seek emergency care. Recognizing when to seek emergency care is imperative. If you develop a blood clot, do not rub your leg. Signs of a blood clot can be one or both of your legs or calf feel warm and increasingly tender or painful. It may look red and have more swelling than expected. You may have a sharp pain in your calf with movement or weight bearing of that leg. Do not rub this leg. If you have chest pain, trouble breathing, suddenly feel lightheaded, or coughing up blood, you need to seek emergency care. If you're actively soaking bandages, this is identified by frequent dressing changes, a nosebleed that won't stop, or blood basically anywhere it shouldn't be. You will have an area of bruising over your leg, which is normal. If you notice an increased bleeding without pressure and ice on your surgical site, you would need to seek emergency care. My job is to help navigate you through this surgical journey here at Gritman. If you have any questions at all, don't hesitate to reach out to me. You'll find my phone number in the front of the book on the inside under Total Joint Coordinator. Thank you for choosing Gritman Medical Center for your care. It's our goal to provide you with exceptional care that's close to home.